flossing remains a very important part of our cleaning routine, but you don't have to floss all your teeth. You can only pick the ones that you really want to keep, and then you floss those.
The month of October is Dental Hygiene Month, and we got hold of Natasha from Floss Practice. So I'm sorry that we were even bothering you in your car, but we've got your time. Natasha, it's great to see you. How are you doing?
I'm good, thank you. Hello, Ilana. I'm good.
Natasha, I've known you as someone who is passionate about teeth for a very long time. From the days that we were studying through marriage and children, and now oral hygiene in the form of an oral hygienist. But before we talk about your practice, I want to talk about the relevance of oral hygiene in this month of October. Why do we celebrate a National Dental Health Hygiene Month? Why is it important that we create awareness about this?
Well, it's a profession worth celebrating, isn't it? During the month of October, we would like to celebrate the work that oral hygienists do, but we as dental hygienists would also like to create awareness about the importance of oral health. That's what it's for.
So what would you say is good oral health?
Good oral health is the absence of disease. Dental hygiene and oral health are often aspects that are taken for granted, but it's part of our everyday lives. We use, we all brush our teeth every day. Well, I hope everybody does. But we use floss and mouthwash and tongue scrapers and all sorts of things to clean our mouths every day. And that's the things that we use to prevent disease.
I remember when I was pregnant with my first, going past the dentist is compulsory. You kind of have to do it as one of the routine check thing. How passionate are you about oral hygiene and pregnancy?
Ooh, it's one of my favorite topics. Also because I'm a mother and I have 3 boys. I've been pregnant. I've been there. I know what it's like. But when you start the journey in your pregnancy, there's so many things. It gets overwhelming because there's a lot of information out there. And I assume with Baby Brunch, you all know there's a lot of information out there. And we don't always know where to touch and where to take and where to leave. And, it can be very overwhelming. So for me, I love it to inform pregnant mommies. I love to see them early in their pregnancy. Even if I can see them when they start planning to have a baby, it's even better because we give them a lot of advice. We give them a lot of information so that they know when they start to have bleeding gums or they start to have problems or they start to have questions like, will my baby take the calcium out of my teeth? Then they already know all these answers. They already know that it's fine and they already know that they are capable of taking care of their own teeth and their baby's teeth.
So, what kind of advice is there if you can give it to us offhand? This is obviously advice that's not just for pregnant women, but for all people. Do we need to floss every day? That whole thing about brushing teeth in the morning and at night, does it still apply? Or do we now add on a third time as well? Or after your pizza and lasagna, do you brush your teeth even more? Do you brush too hard? How do I know if I need to have a soft or a hard toothbrush? This is all the stuff that people ask you in your chair while their mouths are gaping this big. And you're busy scratching in there. So go, Natasha, go.
Yes. Aside from brushing, there's a whole lot of other tools that you can use to clean your mouth. And when you go to an oral hygienist, she will also give you individualized advice. So she will tell you what will suit your mouth because someone might have braces, they will need something else. Someone might have a bridge or an implant, so they will need a different type of floss than just a normal floss. So there's different tools that we can use, definitely. Flossing remains a very important part of our cleaning routine, but you don't have to floss all your teeth. You can only pick the ones that you really want to keep, and then you floss those.
Okay, you got me there. You see, so someone also said to me, you must brush your teeth because they're forever, So if you don't want teeth forever, then don't brush them. So that's really important. For sure. Floss the teeth that you want to keep.
Definitely.
When we think of our babies, I mean, there's so many questions. When do we start with toothpaste? I mean, oral hygiene for our babies and our toddlers. What kind of advice do you have for us?
We would like to start brushing our teeth the moment they come into the mouth. So that's usually by the age of 6 months. And we usually start with toothpaste as well. But we only use a small amount, like a rice grain size smear on the toothbrush. And you can gradually increase the amount of toothpaste until about pea size by the age of 3. Usually when you buy your first toothpaste for your baby, it's good to use a toothpaste that says 0 to 2 years, which means there's not a lot of fluoride in there. So if the baby swallows it, it's still safe for them. But fluoride is the thing in the toothpaste, or the ingredient in the toothpaste, that really helps us to protect the teeth against cavities. So fluoride is important, and we can use them from the first day that we brush the teeth. But we can also start to clean the mouth even before the teeth come out in the mouth. And a lot of people don't know that. You can start to clean your baby's mouth since birth. So you use a small gauze, you know, those small little square gauze blocks that you get. You use one of them, you wrap them around your index finger, you wet it a little bit, and then just wipe the inside of the baby's mouth. So you can wipe inside of the cheeks, over the gums, over the tongue. You've probably seen in infants or in babies, we see like a small white layer, sticky layer on the tongue. That's probably milk residue. So if we clean it regularly, you know, it will probably go away. It might also be a first sign of oral thrush. That's also very common in babies. If it's persistent and it keeps on bothering you, you can see your oral hygienist or dentist or even your pediatrician. They will give you advice how to treat oral thrush. But cleaning the baby's mouth is important. You can try to do it once or twice a day. The textbooks actually suggest that you do it after every feed.
Wow.
Now, I don't know about you, Ilona, but as a mom, that's never ever going to happen. If that baby is asleep, you're not going to wake him up with wet balls in his mouth. You're not going to even try. You're just going to do it like once or twice a day.
Bath time and in the morning when you wash their face and clean their bum.
Yes.
Now, I love the gauze suggestion. You know, the older people always say that a nut lappy, you know, like a clean was lappy. But I like a gauze suggestion because, it's a little bit more hygienic, right? Talking about parents in the chair now. So how important is it to have your teeth checked while you're pregnant? Can you see the oral hygienist while you're pregnant?
Yes, definitely. It's safe to see the oral hygienist or the dentist during pregnancy. If you have a severe dental problem, the dentist will probably have to do some sort of dental procedure. But if they don't do that and the problem evolves and it becomes even worse, it can have serious complications in your pregnancy. And when I talk about serious complications, even up to premature birth. So we don't want to leave serious dental problems, you know, without anyone knowing what's going on. So it's better to go and see your dentist. If it's not that serious, the dentist might ask you to wait until the honeymoon phase of the pregnancy, which is usually the second trimester, or that he will wait until the baby is born. But if it is a serious problem and we need to do dental procedures, there's precautions that they can follow to make sure that the baby stays safe in your tummy. So they'll use injections that doesn't contain any adrenaline. They might use a lead apron on you when they have to take x-rays. So there is ways to do dental treatment if it is necessary. Visiting your oral hygienist, as we've said before, is very important during pregnancy. The earlier I see the patient, the better. Even if I can see her before she falls pregnant, that's even better because we give them a lot of advice. There's a lot of things happening during your pregnancy that makes the gums bleed. You are at a higher risk of getting cavities. So it's good to give them information early in their pregnancy.
Speaking about pregnancy and oral and dental hygiene, Natasha has offered to write an article for us. So if you check out our website on babybrunch.co.za, you'll see her passion project right there. She's giving us practical examples, and also we unpack this topic even further in written form. So pregnancy and oral health, if you want more information, and you can find that on babybrunch.co.za. Natasha, while we still have some of your time, I mean, in your opinion, what is the best way for prevention? How can we prevent all of it? Because teeth are expensive if you have to fix them afterwards.
Definitely. Now, prevention is definitely better than cure. In this case, definitely, you want to install good oral hygiene habits from a very young age. And if we teach our children about prevention and taking good care of our teeth, because when we were little, you know, we didn't even know anything about flossing. I only learned how to floss my teeth when I was studying oral hygiene. There's many ways how we can maintain a good standard of oral hygiene, but I think one of the tools that is underestimated often is flossing, because flossing is one of the most important ways of preventing disease in the mouth. When I started working as a young oral hygienist, I realized that not many people use floss, and of the few people that use it, that don't use it correctly. So my aim is to teach people, young and old, how to use floss properly, how to use it correctly.
Well, speaking of using floss properly, Natasha doesn't just sit in her car to do interviews with us. She's actually showing us how to floss. Take a look at this. That's really good. You see, you should let the children watch the video. Really, really awesome. Thanks, Natasha. Why are you so passionate about cleaning people's teeth and making sure that everyone maintains good dental hygiene?
Ilana, during these troubling times of coronavirus, it's important to remember that you get COVID-19 through your mouth. So having a really good, healthy mouth is very important. If you have poor oral hygiene, if you have a lot of germs and a lot of bacteria in your mouth, the chances of getting a secondary and bacterial infection in your airways and in your lungs is greater. And the same goes for heart problems. If you have poor oral hygiene, if you have a lot of germs and a lot of bacteria in your mouth, those same germs and same bacteria will end up in your bloodstream. We have blood flow through our mouths. We have blood flow through the gums and the teeth. So if the bad oral hygiene or the bad bacteria enters your bloodstream, it goes through your heart, and it goes through your heart by the minute. It doesn't take a week for bad stuff to get into your bloodstream. It happens really fast. I started my independent oral hygiene practice 2 years ago. And when I started my practice, the word floss was something really special to me. It was something that was a symbol of health. And it represents the passion that I have for my profession and the passion that I have to educate people and to teach people about having a healthy mouth. So the name of my practice is also Floss. And on the website, our website is flosspractice.co.za. You can also see there what oral hygiene is all about. If you visit your own oral hygienist, wherever you are in South Africa or in the world, you will not just go for a teeth cleaning, and you're not just going to go to get your teeth whitened. You're going to go to a dental professional who will be able to help you to prevent disease. And that is what it's about.
You just made teeth brushing a whole lot more interesting. You can find Natasha van Reede van Oudtshoorn on flosspractice.co.za. Also follow them on Facebook. It's Floss Practice. And on Instagram, Natasha Floss. And on Twitter, Natasha Floss. Other than that, just floss.